First of all, welcome. I would like to state how happy I am that we are actually talking about potential clinical trials that will happen very shortly. With that, I would also like to amend Spela and Damian for basically doing an awesome job for helping all your children to that basically have a meaningful and full life. So today I would like to basically talk about understanding the toxicology and safety in small and large animals. But first, I would like to highlight why the toxicology studies are important. Of course, we want that this new gene therapy would be functional, it would work. But the first thing that we have to basically identify, and it is at most important, that this therapy is safe. So this is the fundamental findings that we have to basically take out of this so-called toxicity or toxicology studies, is basically to determine the safety profile of the newly developed gene therapy products. And within that toxicology studies, we basically identify and characterize all potential side effects or adverse effects. And we, of course, also determine the safety profile and also evaluate dose and response relationship, support risk and benefit assessment, and of course, by conducting these preliminary non-clinical toxicology studies, we want to basically guide clinicians in order to basically take needed actions in order to mitigate any potential side effects or risk that could develop due to gene therapy. And of course, to ensure the long-term safety for all the patients. So toxicology studies are very important. This first, these non-clinical studies. This is the most important part of this in vivo non-clinical studies, and then later on, also before getting the drug approvals. As we are talking about a drug, we have to bear in mind that every drug, as I stated, of course, we wanted that it would be functional and it would work. We have to bear in mind that when we are talking about new drugs, that every drug can have also potential side effects. And when we are talking about AAVs, these are basically the most pronounced side effects that I really don't like pointing that out here, that are basically found that can develop due to the AAV9 treatment. We won't be mentioning genotoxicity because we are working with AAV9, which has a very low tendency to integrate within the genome. Therefore, we don't need to explain much of the risk of genotoxicity. But as AAV enter the body, of course, patient's immune system will be activated. And this immune system activation can then, of course, leads to some detrimental effect that can unfortunately also basically result in patient death. For instance, the most crucial toxic side effects of AAV9 therapy are so-called thrombotic microangiopathy, dorsal root ganglion toxicity, and of course, liver toxicity. Of course, by introducing AAVs into the patient's body, of course, it will basically happen that some sort of inflammation will occur, but this inflammation can be localized to a very small degree, or it can be developed into a widespread organ inflammation. And also some effect can be seen in lungs. So when we are talking about toxicity studies, we have to basically determine the potential acute toxicity, repeated dose toxicity, chronic toxicity, genotoxicity, carcinogenicity, reproductive and developmental toxicity, immunotoxicity, and also we have to deal with local tolerance. And here is just the summary of all the toxicology study or toxicity study that was conducted by CTNB1 Foundation in order to basically establish that Urbagenis is indeed a safe gene therapeutic. CTNB Foundation basically sponsored three different toxicity studies, where first was solely handedly performed by Andrea, so kudos to Andrea. So she performed a so-called non-GLP single-dose toxicity study in wild-type mice with an 8-month follow-up. Then the most important one is so-called GLP-compliant single-dose 90-day toxicity study that was performed in wild-type juvenile mice, We are here talking about a good laboratory practice guide, a toxicity study that was conducted in Prague in Center for Phenogenomics. And this GLP compliant basically is dictated by the EMA regulation that this toxicology study has to be conducted by methods, materials that basically give us reproducible data. And then later on, also an important toxicity study was conducted also in non-human primates, where we use monkeys as a model organism that closely resembles human anatomy and also physiology of humans. So now I would like to basically show you the key findings of all these three different toxicity studies. So I will firstly start with non-GLP single dose toxicity study in wild-type mice, with 8-month follow-up that was conducted in Australia. So Andrea here basically inoculated 28-day-old mice that resembled basically to the human age equivalent to approximately 6-year-old child. And then she introduced via intracerebroventricular stereotactic surgical injection 2 different doses of AAV9 cTNB viral vector. As a control, she used animals that were not treated and animals that were treated with the AAV9 GFP vector that she presented nicely before. And then for 8 months, she was basically measuring blood. She was collecting blood for further analysis, and she was measuring basically body weight. She observed any behavior changes, their well-being, physical wellness, and so on. And of course, at the end of the experiments, the animals were euthanized, sacrificed, and the organs were harvested for further thorough histopathology analysis. And you can clearly see here on those graphs here in female mice and in male mice that we didn't observe any potential detrimental side effects regarding the development of mice when injected at 28 days old compared to the 8-month old, because we are talking here about adult animals, already old animals. So with that, we can conclude that administration of AAV9 cTNB1 dose did not influence negatively the development of the animals. She didn't also observe any significant changes in behavioral and physical wellness of the animals. She also determined the increased beta-catenin mRNA levels in the brain of the treated animals. And as I stated before, she also took blood for further analysis, where we determined important functions regarding kidney, liver, different parameters regarding the homeostasis of the organism, potassium, sodium, and so on. And we didn't discover any significant detrimental effects in any animals. So there were no influence of potential, we didn't see any signs of potential kidney damage, liver damage, and so on. The final goal was, of course, to check at the microscopic levels all the tissues. And then those samples were sent to Center for Phenogenomics in Prague, where they conducted a thorough histopathological analysis. Of course, they observed some small differences. For instance, if you can clearly see here, we did observe some small infiltration of immune cells within the liver and some changes in symmetry of the ventriculi. And they observed increased cerebral cortex thickness, but only in the high dose of the AAV9 GFP treated animals. We didn't observe any significant changes regarding the thickness of the brain that could basically tell us that there is a wide inflammation within the brain happening in any of those treated groups of mice that received AAV9 cTNB1 drug. So the final report of this 8-month non-GLP tox study was that the study demonstrated that the AAV9 cTNB1 did not induce any adverse biochemical or histopathological effects in wild-type mice. Then later, we performed the most important so-called GLP single-dose toxicity study in wild-type mice with 3 months. This again was used, they used basically the same age old mice, 28-day-old mice, and they were monitoring then the animals for 90 days. Those animals were monitored and basically scored daily on already basically on the clinical sheets that were formed before entering also this study, meaning that food consumption, body weight, water intake, behavior, any aggression, and or anything on basically not normal was basically determined and also monitored. Also hematology, biochemistry, coagulation, ophthalmological examination, gross pathology, and of course, organ-wide full histopathological examination was conducted. Here, animals were again inoculated via the same route that is proposed for your children via ICV injections, where they use a control group, low dose, mid dose, and high dose. And here on these representative pictures of vivisection of those animals that were euthanized at the end of the study, you don't see basically any significant changes. We do observe some pale livers or maybe enlarged kidneys in some animals or fur loss, but there were no gross pathology observed that could be detrimental to life of those animals. So also the final pathology report stated that in low dose, mid dose, and high dose, there were no serious adverse effects observed. I have to state here that we unfortunately had 2 animal deaths in mid dose where they exhibited after a defined period of time after the injection, some unwanted side effects, but after looking closely at those animals and that there were no dose response, they were basically from the same litter, that we were basically pretty confident that this is just due to the strain of the animals. At the end, all tissue sections from those animals were closely monitored by pathologists. A very professional pathologist where they graded basically all tissue sections with grade 0 to grade 4 scales, where basically grade 0 states that there are no changes or changes are so minimal or insignificant, where grade 1 is mild changes with subtle or localized effects, or where grade 4 is basically severe changes that could basically lead to death of the animals. And you can clearly see here that we observe, of course, some findings because we are actually injecting viruses into the brain. For instance, we did see some cell infiltration, some fluid accumulation within blood vessel around the nerves. But if you see closely to these graphs, you can clearly see here that most of the animals exhibit grade 0 and grade 1 pathology signs within the tissue section, meaning mild changes, subtle and localized effects. The same was also observed when checking for potential neurodegeneration within the hippocampus or cerebellum, and of course we didn't observe any significant blood loss or hemorrhage within the brain that were injected. So the official report stated that the test item as administered in this study does not elicit clinically significant neuropathological changes. So with that, we also wanted to additionally confirm the safety of the Urbagen. Therefore, we enrolled a so-called non-GLP single-dose toxicity study in non-human primates, where we use Macaca fascicularis, basically this little cute monkey, which was basically from 2 to 4 years old group. And as I said before, this model organism basically closely resembled to human anatomy, human physiology. And for the NHP non-GLP studies, monkeys were treated with low dose and high dose with ICV injection or ICM injection or biventricular ICV injection. And again, final reports stated that there is no significant changes observed in the brain of the monkeys that were tested. So based on that data, we can conclude that Urbagen is safe. But as we are talking, of course, we're talking about drug, potential side effects. Already clinicians made a all the lists in the clinical protocol that basically determine all the potential side effects or potential risk. And based on those risks, also the mitigation strategy was developed. As Andrea already said, she didn't discover any oncogene upregulation, no tumor suppressor genes were inhibited. Therefore, we already have envisioned the potential risk of cancer. Therefore, a 3-year follow-up with possible extension will basically be allowed. And this is already a mitigation strategy that will basically, that is included in the clinical protocol, which will be presented by Damian tomorrow. Some of the cancer potential will be also be an exclusion criteria. And then if we look closely to the risks that are associated with the AAV9 per se, when we are talking about liver toxicity, thrombocytopenia, thrombotic microangiopathy, all those patients will be closely monitored. And of course, they will be also given potential immunosuppression care, supportive care, and so on and so on. As Ruth nicely exhibited, even if you inject Urbagen directly to the brain, it will be spread through basically whole body, meaning that it can influence cardiac function, renal function, kidney, liver function. All those organ systems will be closely monitored in a clinical trial. As I stated, one of the most detrimental effects that can develop due to the AAV9 treatment is so-called neuronal toxicity and DRG toxicity. This was already nicely mitigated by Lainšček when he designed the vector by introducing microRNA binding sites within the backbone of the vector, meaning that, and also Andrea clearly demonstrated that the expression of the transgene was severely diminished in DRG and liver. Of course, when we are talking about AAV, we have to also bear in mind potential AAV9 antibodies that will be also closely monitored. And as Ruth said, AAV9s will be secreted via saliva, semen, urine, feces, and patients, and of course you parents, will be strictly guided how to deal with these bodily fluids. And I have to state here, having in mind another part of the legislation, that your children are prohibited to give blood donation, cell donation, tissue donation for the rest of their lives. So to summarize my talk, we determined acute toxicity. We didn't determine repeated dose toxicity as Urbagen is envisioned as a single dose therapeutic. We monitored animals for 8 months. We didn't determine any chronic toxicity, although we didn't conduct an official genotoxicity and carcinogenicity and reproductive and developmental toxicity. Like I said at the beginning, we don't need to conduct genotoxicity study because the tendency to integrate to that AAV9 will integrate into the human genome is basically very, very minimal. And although as no official carcinogenicity and reproductive developmental toxicity was conducted, Andrea clearly demonstrated that the animals were basically thriving normally through their whole life, and that there were no tumor development. As Ruth also said, we are still waiting for some final data regarding antibody, blood coagulation factors, so we'll still have to conclude the data in immunotoxicity. And by checking also the injection site within the brains on the skin surface, we didn't observe any local tissue irritation. So therefore, we also conducted a local tolerance toxicity study. So with that, I would like to thank all the people that helped in this part of on this pathway towards clinical trials, and I would like to thank you for your attention.